Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele, presenting the Health Equity Teacher module, Preventing and Addressing Provider Burnout. The previous presentation about provider burnout, we talked about what burnout is, how it affects both providers and their patients, and what burnout looks like in the health professions across the United States. In this presentation, we hope to now look to how we can combat burnout. The objective of this presentation is to explain interventions that can be implemented at both the individual and organizational levels to prevent and address provider burnout. So first, let's start with the strategies for the individual. But before I begin, I'd like to just emphasize that these strategies, just knowing about them, the idea for this presentation is to introduce these strategies to you, but just knowing them won't necessarily prevent or address burnout. These are strategies that individuals must practice and routinely implement in order to truly help themselves combat burnout. The first aspect that I want to talk about is prioritizing physical self-care. This includes what you put in your body in terms of nutrition. I won't go into the details of a balanced, nutritious diet, but plenty of vegetables and fruits, high fiber, low saturated and trans fats, all those things that we learn in our nutrition units. Make sure that you're practicing them with yourselves, as well as making sure that you're eating enough to fuel your days, your long days at your practices. You also want to make sure that you are using alcohol at a low risk level, meaning that you're not drinking more than your recommended amount per day, whatever that amount is for your sex, and as well as using coffee and caffeine in moderation, especially when it gets closer to the time when your body is supposed to be sleeping. So if you're on a normal day to night schedule, in the afternoon, not using coffee and caffeine as much so that you're able to rest when you go home, and as well as not using tobacco, not smoking tobacco, chewing tobacco, as that is very dangerous for your body. Another aspect of your physical self-care is sleep. Sleep is so important, and the goal is that you are getting 7 to 8 hours of sleep per day or per night, depending on what schedule you're on. And with a lot of healthcare professionals' schedules, sometimes that may not be possible with what you're doing, but try to get there as close as you can. And you can do that with napping in small periods when you have the opportunity to. And if you are sleeping when you're on call or between shifts, make sure that you're optimizing your sleep conditions to make sure that you're getting the best sleep that you can. So whether you need the windows, the shades closed, earplugs, eye mask, things like that, make sure you're taking the steps to get the sleep that you need. And then when you do have the opportunity to catch up on sleep, make sure you take advantage of that and really build up that sleep reservoir. Another part of physical self-care is exercise. Just like we like to encourage our patients to do, make sure you get regular, moderate exercise in your schedule, at least 150 minutes a week. And you can do this by fitting exercise into your schedule when you can, where you can. So whether that's taking the stairs at work, walking to and from your car to your house or your work building, walking home, riding a bike home from work, doing things that fit within your schedule, using the gym at your practice or your hospital if there is one available to you, things like that, to make sure that even if it's 15 to 30 minutes at a time, you're still getting the exercise that you need to make sure that your body is healthy and strong. Lastly, for physical self-care, I'd like to make sure we emphasize that even though we're doctors or nurses or APRNs, whatever healthcare professional you are, you cannot be your own healthcare professional. We do still need our own primary care providers to make sure that we are healthy and well. On the other side of the coin, there's mental health. So we also want to make sure that we are prioritizing our mental health self-care. Part of that is your mindset. And with the high stress job that comes with the healthcare professions, it's very important to be aware of the influence of perfectionism and whether or not that perfectionism mindset is helping or hurting you in whatever situation that you're in. So you can ask yourself questions like, what difference will this make in a week, a year, or 10 years? Am I blaming myself for something that is beyond my control? Am I thinking in all or nothing terms? All or nothing thinking can be pretty dangerous in terms of mindsets. So that's one thing you can do for your mental self-care. Another thing that is so important is to create and maintain supportive relationships, whether that's with family, friends, or partner. The key word here is supportive. You may have relationships in your life, but you truly need supportive ones that you can rely on to really get through your workday, your life, everything together. And this means that you should set boundaries with these individuals and expectations, what expectations they may have for you and your job, when you'll be home, when you'll be at work, when you can give time to these relationships, when you might not be able to give time, and set boundaries. Make sure that you're able to enjoy the time that you have with these people when you're with them, and not let work impede in those relationships. This can be simple as phone calls, emails, visiting in person, taking vacations together when you can, looking for people that have common interests that you can really enjoy your time with. In addition to relationships, it's also good to have intellectual diversions. And these are things that bring you pleasure, that are maybe a passion of yours, that are outside work. So they're not what you're looking at on a day-to-day basis at work. They may be somewhat related. They could be in a completely different area. It might be reading. It could be playing a sport. It could be anything under the sun that allows you to take a break from work, but still allow you to do something you enjoy and really exercise your mind that way. It's also important to make sure that the values of your employer or occupation align with your values, as if they don't, that can be a big source of conflict, internal conflict for you. When they do align, it can be a source of intrinsic motivation for you to really want to do your job, not just for your payment and benefits that you get extrinsically, but for the intrinsic motivation of it aligning with your values. Lastly, when you're prioritizing mental self-care, it's important to accept that change is a constant. Things will always be changing, and we need to be flexible and open to it, as well as jump at opportunities for change and advancement, because we know that the medical field is always moving forward. We need to be able to do that as well. In addition to these self-care aspects of individual strategies, there are also active ways to reduce stress. These could be through formal stress reduction programs, like learning cognitive behavioral techniques, group counseling, whether that's provided by your employer or something that you seek elsewhere, stress management workshops. These are programs that you can partake in to learn how to actively reduce your stress. You can also practice mindfulness. Mindfulness is a self-directed practice for relaxing the body and calming the mind through focusing on present moment awareness. There's a lot of different ways to practice mindfulness. And again, it's something that you have to really actively work on and repeatedly do to really allow it to reduce your stress. There's also interventions called balance sessions that have been implemented in certain healthcare areas, where there are group sessions that train doctors how to apply a patient-centered approach with a special focus on the doctor-patient relationships. And this has been seen in a few studies to improve the providers' mental well-being as they are building relationships within their work and really intrinsically motivating themselves through these doctor and patient relationships. those were a ton of strategies that we just went over for individuals for preventing and addressing burnout. Again, like I said at the beginning, it's not something that you read or hear and automatically are good at. It takes time and practice to time manage, to set boundaries, to prioritize your mental and physical health. It's hard with the schedules and commitments that healthcare providers have. So I encourage you all to take a few of those, take baby steps, and start practicing to improve your own mental health and start preventing your own burnout. But now I'd like to talk about strategies for the organization. So things that we can do on the institutional level to prevent burnout within employees, within students, and really get to the source of it. So in terms of educational institutions, when it comes to graduate programs, undergraduate programs, for our health professionals, there are certain things that the institutions can do to prevent and address burnout within their students. The first is recognizing that it's a shared responsibility. It's not just on their students to take care of their mental health. The education institution has to be partially responsible for burnout and preventing burnout through providing resources, through measuring student well-being, optimizing the curriculum, meaning that their curriculum has to be appropriate for the students, for their time, for their abilities. I think we've all been in situations where we've been in a tough curriculum and it really takes a toll on our mental health. So the school can do their part in that. The school can also help control student debt, whether it's offering scholarships, aid packages, revisiting and revising their own fees and tuitions. The education institution can also optimize learning environment and cultivate community within their classes. Again, this is altering what they're doing, where they're doing it, how they're doing it to make it less stressful, more engaging, more collaborative and teamwork based within the classroom. They can promote self-care and resiliency through resources, group counseling. I know many graduate programs offer peer-to-peer counseling, counseling with professionals at the institution. There's a lot of things that educational institutions can provide to promote self-care. And then as well as if there has been someone identified with burnout or distress within their class, that they provide the adequate resources and services for those individuals. Educational institutions can also fund organizational science around well-being to better the well-being of their future students. Similarly, employment institutions can do a whole lot to protect the mental health and prevent burnout within their employees and then address the burnout if it is happening. One thing that they can do is appoint effective leadership and invest in leadership development. If there is good leadership, it'll trickle down to hopefully create a better environment overall and create a better team overall for the employees. Having sufficient and appropriate hiring. A lot of times burnout can come from being stressed out on the job, there not being enough hands, having too much of a workload. If there's appropriate hiring and sufficient amount of employees to cover the tasks that need to get done, burnout can be prevented. Similarly, if there's flexible work arrangements in terms of scheduling hours, it can also alleviate stress. And healthcare institutions can reduce technological burden by improving electronic health records. This is a tricky one as technology has been seen to go both ways. Improvements to electronic health records have been seen to improve and prevent burnout within healthcare institutions, but implementing healthcare record or electronic healthcare records where there previously has not been any electronic health records can be a source of stress and actually cause burnout. So it's important to, when looking at electronic health records and how they cause or alleviate stress, looking at what the institution already has in place and how they can improve it, as well as if they're implementing something new, giving the employees the proper training on how to use it effectively. Another thing that employers can do is reduce the burden of non-clinical activities, whether that's employing more people to do the non-clinical activities or spread out the burden of those non-clinical activities among the team. Employment institutions can also improve the relationships between colleagues, the peer support that they have, and encourage discussion within them, whether that's through formal meetings, informal discussions. There's a lot that they can do to promote that teamwork, because it's seen through studies that teamwork works and that you can optimize and prevent burnout through teamwork, providing team-based care where one person is not responsible for everything. Instead, everyone's working together. There's a shared responsibility in which that allows for the burden to be less on just one person. An example of this is using scribes to input information into the electronic health record. That has been seen to be very successful in optimizing teamwork and reducing burnout and stress, as well as teamwork can increase communication between providers to create a better environment for the team and reduce stress levels. Employment institutions can also do targeted quality improvement projects to improve the workflow design of the practice, of how they see and work with patients, basically the efficiency of the practice, how they do things, the quality of it, how it works. By improving these things, it can alleviate stress and burden on the providers. Employment institutions can, again, like the educational institutions, invest in provider well-being, providing the tools and resources for individual interventions that we were talking about before. Now, that was a ton of different interventions at many different levels and approaches that I just went over. And again, I'd like to repeat that it's not something that once you know what to do, it's going to go away, that burnout's going to go away immediately. It takes effort, it takes dedication on both the individual and the organization side of things. But I would like to now just show a resource that has a lot of different resources for both individuals, for institutions, on how they can prevent burnout and promote well-being. So it's called the AMA Steps Forward, and they have a burnout and well-being section in which there are mini courses with information, with little presentations and tests that you can take to test your knowledge on this stuff. But there are individual courses for physicians, for medical students, for residents, for hospitalists, many different healthcare professionals, and different areas at different stages, as well as more institutional and organizational sides of things. So the AMA Steps Forward program can be a great tool for anyone to look at and learn how to promote their own well-being as well as the well-being of others. That's all I have for this interventions for addressing and preventing provider burnout. I wish you all good luck in now taking these interventions into your own lives and practices to prevent and address any burnout that you or your peers may be experiencing. Thank you.